Hello, everyone. My name is Andrew Langwa, and today I'll be walking you through the process of conducting a therapy session. We'll go over each stage in a structured approach, emphasizing the importance of ethics, professional standards, and evidence-based practices. The objectives for this presentation will be explain the structured therapy process, identify the key stages of a therapy session, discuss ethical and professional responsibilities, highlight evidence-based techniques, align these practices with the National Association of Social Workers Code of Ethics. By understanding these principles, social workers can create an effective therapeutic environment that fosters trust and client progress. The therapy process follows five structured stages: relationship building, assessment and diagnosis, goal formulation, intervention and problem solving, and termination with follow-up. These stages ensure consistency, ethical adherence, a structured approach that helps both practitioners and clients navigate the therapeutic process with clarity and purpose. Throughout this process, social workers must maintain professional boundaries, practice cultural competence, and uphold strict patient confidentiality. Stage one, relationship building. Therapy begins by identifying the client's need for therapy. Clients may seek therapy for various reasons, such as emotional distress, trauma recovery, relationship issues, or personal growth. Recognizing this need helps social workers tailor interventions effectively. Clients may realize they need therapy due to constant stress, difficulty coping with life events, or encouragement from friends, family, or other professionals. Sometimes clients seek therapy proactively to improve self-awareness and personal development, while others may turn to therapy when they feel overwhelmed by their emotions or circumstances. Building a strong connection with clients starts by creating a safe and supportive environment. Active listening, showing empathy, and using non-judgmental communication are keys to building trust. Some examples of active listening are paraphrasing the client's statements or summarizing what they have shared so far, or using reflective listening techniques such as, "It sounds like you're feeling overwhelmed." Empathy plays a crucial role in establishing trust by showing clients that their emotions are understood and validated. Empathy can be expressed by acknowledging the client's emotions with statements like, "That sounds really challenging," or by using reflective listening to ensure that the client feels heard. Non-judgmental communication involves open-ending questions such as, "Can you tell me more about that?" and using neutral language to avoid making assumptions or passing judgment. Building on active listening and empathy, social workers should then explain the purpose of the session because it helps set the tone for what the clients can expect and provides a roadmap for their progress. When clients understand the purpose of therapy, they are more likely to engage openly and feel comfortable participating in discussions. The fear of the unknown can create anxiety for clients, so having a clear understanding of the session's purpose helps alleviate uncertainty and fosters a sense of control. After establishing this understanding, social workers should then explain the purpose of confidentiality separately from session expectations. While understanding the session's purpose reduces uncertainty, confidentiality reassures the clients that they can share openly without fear of judgment or being exposed. Protecting client privacy builds trust and is essential for ethical practice. Social workers should outline confidentiality limits and what clients can expect regarding privacy and ethical guidelines during the sessions. Setting clear expectations and obtaining informed consent fosters open dialogue and lays the groundwork for a successful therapeutic relationship. So, stage two, assessment and diagnosis. In this stage, social workers gather the client's history and concerns. This is done throughout structured interviews, psychological screenings, and behavior assessment. These tools will help identify any underlying issues and ensure the intervention plan aligns with the client's specific needs. A comprehensive assessment involves more than just gathering data. It is also about understanding the full scope of the client's experiences, strengths, and challenges. Social workers must approach assessments with cultural humility, recognizing how a client's background, environment, and personal history shape their challenges and needs. A thorough assessment also includes evaluating a client's support system, coping mechanism, and any barriers that may impact progress. Accurate assessments allow for tailored interventions. Social workers must ensure assessments are culturally competent and ethically sound. This means using language that is accessible to the client, considering social and economic factors, and recognizing that potential impact of trauma. By fully understanding a client's background and needs, we can create effective strategies for positive change and long-term success. Stage 3, formation of therapy goals. Effective therapy requires more than just identifying client concerns. It also involves setting goals that provide direction and measurable progress. Once the assessment is complete, social workers and clients work together to develop clear, achievable therapy goals. These goals should be measurable, attainable, and tailored to the client's specific needs. Setting realistic expectations ensures that therapy remains client-centered and progress can be tracked effectively. By working together, clients and social workers can set meaningful and achievable goals, ensuring that therapy remains focused and effective. Social workers should guide clients in identifying short and long-term goals, ensuring that they align with their values and circumstances. It is important that throughout this process, it remains a joint process, without pressuring clients or making them feel like they have no say in their own treatment. Goals may focus on coping strategies, behavior modification, emotional regulation, or improving relationships. Additionally, therapy goals must remain flexible. Clients may experience unexpected life changes, shifts in their priorities, or new challenges that impact their therapeutic goals. Regularly revisiting and adjusting goals ensures that therapy stays relevant and effective. This helps clients stay motivated and engaged in their progress, reinforcing their sense of autonomy and control over their personal growth. Social workers should involve clients in these adjustments to ensure they feel heard and empowered in shaping their own progress. Fostering a joint approach to goal setting and adjustments, social workers can strengthen the therapeutic bond and help clients maintain long-term success. Stage 4, intervention and problem solving. Therapy plans are not a one-size-fits-all. They must be flexible and adaptive to meet the unique needs of each client. With goals in place, the intervention phase begins. Social workers implement evidence-based therapeutic techniques to help, such as cognitive behavior therapy for identifying negative thought patterns, mindfulness techniques for emotional regulation, and problem-solving therapy to develop effective coping skills. Clients address their concerns and develop healthier coping mechanisms. This phase involves guiding clients through problem-solving strategies, emotional processing, and behavior changes that support progress towards their goals. Intervention methods should be tailored to each individual. What works well for one client may not be as effective for another. So social workers must remain flexible and open to adjusting techniques based on their client's response. Some clients benefit from cognitive behavior techniques, while others may find success in mindfulness practices or solution-focused therapy. The key is to match interventions with the client's needs, their strengths, and their weaknesses. Throughout this phase, active client participation is essential. Social workers should encourage self-reflection, reinforce progress, and adjust interventions as needed. Ethical considerations such as obtaining informed consent, maintaining professional boundaries, and respecting clients' autonomy must remain a priority in all therapeutic interactions. Social workers must also ensure that intervention aligns with the client's cultural background and personal values while promoting the client's well-being and avoiding any potential conflicts of interest. Upholding confidentiality, securing informed consent for all treatment plans, and providing clients with the necessary information to make informed decisions about their care are essential to ethical social work practices. Stage 5, termination and follow-up. Ending the therapy session is just as important as the beginning. Termination phase should be intentional, ensuring clients feel prepared for their next steps. Termination is a planned and structured phase that ensures clients leave therapy with tools they need to maintain progress. Reviewing client achievements, reinforcing coping strategies, and preparing clients for independence are all key components of this stage. Evaluating client readiness for termination is crucial. Social workers should assess whether clients feel confident managing future challenges, address any unresolved concerns they may still have, and discuss potential setbacks. Ensuring a smooth transition minimizes the risks of setbacks in the future. Follow-up planning is equally as important. Social workers should connect clients with culturally appropriate resources, such as local mental health organizations, peer support groups, or online tools that are tailored to their needs and cultural backgrounds. Providing clients with a roadmap for continued success empowers them to sustain their progress and independence. All right, to sum it all up, through structured assessments, goal setting, intervention, and termination, social workers provide clients with the skills and resources they need for long-term success. This presentation covered the 5 key stages of therapy: building trust, assessing client needs, setting goals, working on solutions, and ensuring a proper termination process with follow-up. It is essential to assure that clients feel fully supported as they transition out of therapy. Recognizing why clients seek therapy is a first step in providing effective and personalized support and directly addresses their unique needs and circumstances. Ethical principles such as confidentiality, cultural competence, and informed consent play a significant role throughout the entire course of therapy. By applying structured, client-centered, and evidence-based approaches, social workers can enhance therapy effectiveness and build long-term client trust. The following slide is a list of resources that I use throughout the presentation, and there will be a link to the YouTube video as well. And this concludes my presentation. Thank you.